Hi friends, it's Sarah. I just wanted to give y'all a quick update on what's going on. Today is January 23rd, 2023. I know it's been a couple of months since I've given you guys an update. So regarding my thoracic outlet syndrome, I had my fourth venogram angioplasty. The fourth one happened on November 17th, 2022. The doctor was able to go in and decompress the arteries and the veins. So I've had a lot of relief. I've had help with, no longer having migraines and headaches, more movement of my arm, and I haven't had, the numbness and tingliness. I still have, my restrictions, and I will have to, do physical therapy lifelong and follow-ups, do maintenance treatments for this. But overall, I'm feeling good. Get tired a little bit, but I know my limitations and not to push it. The thing that the doctor did find is that when he was doing the venogram angioplasty, he did come across that both my subclavian veins on both sides, so bilateral, are divided. So this is a birth defect, and he says it's probably the cause of why I'm having thoracic outlet syndrome neurogenic. He does not recommend to have surgery. He said it's very invasive, and that if we can maintain, quality of life and keep, my disability in control with this, that we should just continue to do, the venogram angioplasty. There's no way to tell exactly what is dividing, the subclavian vein unless having invasive surgery. And so right now he kind of just described it as it looks like a little island in between both sides. So, just say some prayers for me, and I will keep you posted on that part. The new development that I have is in June 23rd, 2022, I slipped and fell getting out of the shower. I landed on my right buttocks and hip area. At the beginning, I thought it was, just a normal, fall and, bruising of the hip. And for a couple of days, just rested, ice, Tylenol, over-the-counter stuff, a heat pad, and just resting. Thought it was going to get better. It didn't. It progressed to where I was having numbness, tingliness, stabbing pain, radiating pain, a burning sensation on my buttocks, and it would radiate down my leg. Weakness in the leg on the right side, unable to lift my leg, and just, affected my quality of life. Things that would trigger it was standing, sitting down, laying down, so basically anything. And so my quality of life was non-existent. I decided to go see a doctor. This was probably 2 weeks post my fall. Right off the bat, when I described my symptoms, they were thinking something was wrong with my spine or my hip. And they were saying that it looked like possible true sciatica. And so they ordered an MRI and an x-ray. Got those done. The x-ray and the MRI came back clean, meaning that there was no indication, no damage to my spine, which is good news. But the concern was that there was still something going on, and I was still having pain. So the doctor thought that, it might have been a very bad fall. So let's go ahead and, rest, start you on some oral steroids and start physical therapy, and hopefully you get relief. So I did that. The steroids they gave me was 20 pills, and you would take them first day you take 5, and you decrease it until you get to, you have none left. While I was on the steroid oral medication, I felt great. I had relief. I basically was back to before falling. And so I was like, okay, maybe this will fix it. As soon as the medicine wore off, I was back to square one. I was having the excruciating pain down my side. I wasn't able to sleep. Daily life activities were impossible for me to do. So I went back to the doctor, and they said, it could be that you just need more time to heal, continue to do physical therapy. The other option is we can refer you to pain management, and they can give you pain medicine to help you with this, or we can do a steroid injection. So for me, I didn't want to take pain medication, and also I wanted to get a diagnosis to see what is actually happening, and so we can actually treat the diagnosis and not just a symptom. So with that being said, I decided to forfeit, going to pain medicine and continue looking for other avenues to get better. So with this, I went to physical therapy, chiropractor, acupuncture, dry needling, massage therapy, yoga, and resting in ice and just over-the-counter medicine. I was still having, very severe pain on the scale, 8, 9. I started doing research online. I came across a doctor online that was talking about the same symptoms I had. And to my surprise, it was very similar to thoracic outlet syndrome, where your brachial plexus, those nerves, are being compressed by, the scalene muscles. So this doctor, out of Nebraska, talks about how Piriformis syndrome is basically like the twin sister of thoracic outlet syndrome. And so it's the same concept, the piriformis muscle is, compressing the sciatica nerve. And so this is what causes the sciatica-like symptoms. So true sciatica comes from the spine. 95% of the cases are true sciatica, meaning you have a bulging disc or a herniated disc. And there's those, rare 5% that comes from the piriformis muscle. This means that the piriformis muscle has been damaged or has been injured, and the muscle starts to spasm and it starts putting pressure on the sciatica nerve, causing the sciatica-like symptoms. So the only downfall with this surgeon is that he does not accept, insurance. He does private pay, and it's very expensive, and it was out of state. I found another couple of doctors, and again, the same thing. They did not accept insurance. I continued, hopelessly trying to find a solution. I came across a peripheral nerve surgeon in Texas. There's actually only one, and it's in Houston. I live in Frisco, Texas, which is North Dallas area. I reached out. They were actually able to get me in. So in October 31st, I went down to Houston. They scheduled me for MRI neurography and an EMG testing. The neurography, there's only one machine of these in Texas, and it's actually in the Methodist in Houston. So I went out there, got that done, and then also did the nerve conduction test. On November 11th, 2022, I met with a surgeon, and we went through, the diagnosis and figuring out if it was true piriformis. We went through, the conservative treatments, which I had failed at. I was already at 5 months post my fall, and I should have had some improvement with the conservative treatments. So after discussing this, going over my results, the doctor confirmed that I did have piriformis syndrome, and that he recommended that I did one more conservative treatment, which was a steroid injection or Botox into the buttocks in the piriformis muscle. And then to complement that with, doing physical therapy. So I went ahead and scheduled that, back here in Frisco. And then if that, did not continue to help, or I was still in the same amount of pain, then the last resort was going to be surgical intervention. So the doctor did preface with the fact that, these steroid and Botox injections, he goes, are mostly used as a diagnostic tool to confirm piriformis syndrome. So the doctor said that most of his patients, when they get these injections, they can last a couple of hours, or they can a couple of days, maybe at the most a couple of weeks, 2 weeks of relief, and then the symptoms come back again. He goes, the good thing is that if you do get relief and this, it just confirms that it is the piriformis muscle. So I went ahead, moved forward with, doing the conservative treatment. And then I also got a tentative date for surgery scheduled. I was having a follow up with the doctor and let him know that, I got this steroid injection December 2nd, 2022. I had relief for a couple of days, at the most, probably like 2 weeks that I got relief, but slowly I could tell that the medicine was wearing off, and that my leg and hip were getting back to the, the pain, the radiating pain, the numbness, the tingliness, the stabbing, a burning sensation, and just achy throughout my whole leg, weakness. So I decided to move forward with surgery. I will be having piriformis surgery on February 7th, 2023 in Houston, Texas. Surgery is outpatient. They will be doing a 4-inch incision on my right buttocks, removing the part of the piriformis muscle that is compressing the sciatica nerve. The doctor will go in there and clean out any scar tissue. They will put a Versa wrap on top of the sciatica nerve in order to protect the nerve and make sure that it glides correctly. After that, they're going to put sutures inside and then sutures on top that will dissolve. I have post-op 3 weeks afterwards in Houston, and then hopefully at the 6-week mark I can get back to some normal activity, working out. I will have to do physical therapy. I'm excited to have a diagnosis, to have a treatment plan, and hopefully this will give me quality of life so I can get back to normal. And hopefully if anyone is experiencing the same thing, that this helps you guys. If you have any questions, you can send me a message and I will provide you with the contact information for the doctors that assisted me. Hope you guys have a wonderful Monday. Talk to you later. Bye.